Sexually transmitted infections, or STIs, are more common than many people realize. They can affect anyone who is sexually active, regardless of age, gender, or orientation. The tricky thing about STIs is that many of them can be silent, showing few or no symptoms in the early stages. This means people may carry and unknowingly spread infections to others. However, there are certain warning signs that should never be ignored. Recognizing these signs early and seeking medical attention can make a huge difference in your health and the health of your partners. Here are 6 dangerous signs you might have an STI that you should watch out for. First, let's talk about unusual discharge. It's normal for the body to produce some fluids, but when you notice a change in color, consistency, or smell, it could indicate an infection. In women, vaginal discharge that becomes yellow, green, or gray, or that has a strong, unpleasant odor, is cause for concern. For men, any discharge from the penis, especially if it is white, yellow, or green, should be investigated. Discharge often accompanies infections like gonorrhea, chlamydia, and trichomoniasis. If you notice these changes, it's important not to brush them off as something minor. Even if there's no pain, abnormal discharge is your body's way of telling you something isn't right. Second, pain or burning during urination is a classic warning sign. Most people associate this symptom with urinary tract infections, but it is also common in many STIs, including chlamydia, gonorrhea, and herpes. The pain can range from mild discomfort to a sharp burning sensation. It may occur every time you urinate or just occasionally. If you find yourself dreading trips to the bathroom because of this pain, don't ignore it. It's a clear signal from your body that something is wrong, and getting tested can help you get the right treatment and prevent complications. The third sign is the appearance of sores, bumps, or warts in the genital area or around the mouth. These can look very different depending on the infection. Herpes, for example, typically causes painful blisters or sores that break open and take time to heal. Syphilis can cause a single, painless sore called a chancre, which may go unnoticed, but is highly infectious. Human papillomavirus, or HPV, often leads to the development of warts, small fleshy growths, on or around the genitals. If you notice any unusual bumps, ulcers, or sores, even if they don't hurt or itch, it's important to get checked out. These lesions can also increase your risk of contracting or spreading other infections, including HIV. The fourth dangerous sign is itching, irritation, or redness in the genital region. While mild itching can be caused by things like soap or laundry detergents, persistent or severe irritation is often a sign of an STI such as trichomoniasis, pubic lice, or even herpes. You might experience swelling, a rash, or a burning sensation. Sometimes the skin may look raw or inflamed. These symptoms can be uncomfortable and embarrassing, but they should not be ignored. Addressing them promptly can prevent the infection from worsening or spreading. The fifth warning sign is pain during sex. Sex should not be painful. If you experience discomfort, pain, or even bleeding during or after intercourse, it could be due to an STI. Chlamydia and gonorrhea are notorious for causing inflammation in the reproductive organs, leading to pain deep in the pelvis or lower abdomen during sex. Infections can make the tissues more sensitive, and in severe cases, they can lead to pelvic inflammatory disease, which can cause chronic pain and even infertility. If sex suddenly becomes uncomfortable, don't assume it's just stress or lack of lubrication. Listen to your body and get checked out. Finally, flu-like symptoms such as fever, body aches, swollen glands, or fatigue can also be a sign of an STI, especially in the early stages of infections like HIV or syphilis. When your body is fighting a new infection, it may respond with symptoms that resemble the flu. In the case of HIV, some people experience a fever, sore throat, rash, and swollen lymph nodes within a few weeks of exposure. Syphilis can cause a whole-body rash and flu-like symptoms after the initial sore goes away. Because these signs can easily be mistaken for a regular cold or flu, people often overlook them. However, If you've had unprotected sex or a new sexual partner and suddenly develop these symptoms, it's important to consider the possibility of an STI. Let's take a step back and remember that these signs are not exclusive to STIs. Other conditions or infections can cause similar symptoms. However, if you are sexually active and notice any of these changes, it's better to be cautious. Many STIs can be treated effectively if caught early, but delaying treatment can lead to serious long-term health problems, including infertility, chronic pain, and an increased risk of certain cancers. In some cases, untreated STIs can even become life-threatening. It's also important to remember that some STIs, like chlamydia and gonorrhea, can have no symptoms at all, especially in women. This is why regular screening is vital, even if you feel perfectly healthy. The Centers for Disease Control and Prevention recommend annual STI screening for sexually active individuals under 25, men who have sex with men, and anyone with new or multiple partners. If you have a steady partner, it's a good idea for both of you to get tested before becoming sexually active together. This not only protects your health, but also strengthens trust in your relationship. If you do notice any of these 6 dangerous signs, don't panic, but do take action. The first step is to stop sexual activity until you've been checked out by a healthcare provider. Make an appointment with your doctor, a sexual health clinic, or a local health department. Be open about your symptoms and your sexual history. Remember, healthcare professionals are trained to help and will treat your information with respect and confidentiality. During your visit, you may be asked to provide a urine sample, a blood test, or a swab from the affected area. Some tests can provide results within minutes, while others may take a few days. If you do test positive for an STI, your healthcare provider will discuss treatment options with you and explain how to prevent spreading the infection to others. In many cases, a simple course of antibiotics or antiviral medication can cure the infection or keep it under control. It's also important to let your sexual partners know if you've been diagnosed with an STI so that they can get tested and treated as well. While this conversation can be uncomfortable, it's a necessary step to protect everyone's health and stop the cycle of infection. Finally, prevention is always better than cure. Consistently using condoms or dental dams, getting vaccinated against HPV and hepatitis B, and having open, honest conversations with your partners about sexual health can dramatically reduce your risk of getting an STI. Don't be afraid to ask questions or seek information. Knowledge is your best defense. In summary, watch for unusual discharge, pain or burning during urination, sores or bumps, itching or redness, pain during sex, and flu-like symptoms. If any of these appear, don't ignore them. Get tested, get treated, and take steps to protect yourself and your partners. Your health is worth it.